Hello, this is Dr. Kavian Malani for Virginia Medical Updates. Today we'll be talking about cholesterol and a breakdown of cholesterol and the times where it's essential to treat cholesterol with statins or other medications. As you know, cholesterol is a natural product that the body makes by itself. It is a building block of cell wall. It's a building block of multiple substrates in the body. The body does use cholesterol to create, to build hormones. It is a building block of a number of important hormones and substances. And so therefore, the production of cholesterol by the liver is really essential, and it is an essential part of life. Now, cholesterol, when it builds up in the form of plaque, in the form of bad cholesterol, and causes endothelial damage in the arteries and in the small capillaries, it basically creates a situation where inflammation kicks in, and the patient then has the buildup of plaque and hardening of the arteries, and these plaques can rupture and then cause heart attacks downstream. So in general, cholesterol has been a major issue for the medical community and for the community at large for decades now, and there seems to be some very important studies and important knowledge that has been gathered and accumulated over the past 20 years. In general, so cholesterol is a product that the body makes by itself. The cholesterol obviously comes in different forms. So there is the HDL cholesterol, which basically is the high density lipoprotein cholesterol. This cholesterol is known as the good cholesterol. Then there is the LDL. The LDL is known as the bad cholesterol, and it's thought to be the one that is most involved in atherogenesis and in any kind of problem in terms of the cholesterol buildup and coronary artery disease. So the total cholesterol is usually what people talk about in terms of my cholesterol. People will say my cholesterol is 160, my cholesterol is 220. That's the number they're talking about, which is a summation of these two plus another element. The most important thing about cholesterol is that this level by itself is almost irrelevant to your well-being. So the total cholesterol that we talk about really by itself is not enough information to make any clinical decision based on the one number. So the issue really is, how is this cholesterol packaged by the body, and what are the proportions of different types of cholesterol in the body? So let's say, for example, that someone's cholesterol is 220. Well, this number appears to be too high, correct? Because we all have a mental picture of the ideal cholesterol being around 200 or less, correct? However, if this person has an HDL of, let's say, 75, then this person's risk ratio with such a wonderful, good HDL basically is going to be, the risk will be equal to the total cholesterol divided by the good cholesterol. Now pay attention here, this is important. So when you're in the doctor's office, or when you look at your numbers online or read about them, you can actually figure out what the risk is. So the risk really is going to be total cholesterol divided by the good cholesterol. So if this is 220 and your good cholesterol is about 75, mental math will give you that this is about a ratio of 3. And a ratio of 3 basically is very good, because a 5 would be average risk, a 3.5 would be half average risk, and therefore a 3 is below half average risk. And that is a very, very good number for cholesterol. Now, in terms of cholesterol, if you had the same patient with a HDL of, let's say, for example, instead of 75, let's go with an HDL of 30, okay? This person's risk ratio would be what? Would be 220 divided by 30. And the risk ratio here, you could tell by mental math, is going to be more than 7, correct? So 7 is high. And 7 is high because 9 is 2 times average risk. So you could see that by a simple alteration in the number of HDL, risk and cardiac risk goes up and goes down. So really one important factor in wellness is the HDL number. A number that I have here for 30 is most consistent with people that are out of shape, diabetics, people that have obesity, people that don't have physical activity, or genetically have low HDL. And that is by itself a risk factor. Now, people on the other hand that have high HDL, like the number that I gave you for 75 for our hypothetical patient, that is a very high number. That's something that I see in marathon runners and in elite athletes, or some people that have kind of genetically very high HDL. So I want everyone to focus on this ratio. So the ratio of the total cholesterol to your HDL good cholesterol is an important way to figure out and navigate, and it's an easy way for all of us to begin to, as people that are vested in our own care, to follow and track our well-being. So don't get too worried about a particular number. What you really have to be worried about and concerned and focus on is this risk ratio of a total cholesterol divided by a good cholesterol. Let me give you an example. If I ask someone, what is your risk of exposure in the stock market, for example? You could say, well, my risk of exposure in the stock market is my total investment divided by my good investment. The larger your good investment is, the larger your good is, the risk goes down. The same thing happens with cholesterol. So if you have a very strong, solid HDL, then your cholesterol actually really doesn't matter what the number is per se. Basically, the ratio, if it's low, is very beneficial. And in fact, studies have shown that an HDL of 59 and above is actually protective. It's a negative risk factor for cholesterol. So by itself, if you can push your cholesterol, your HDL cholesterol above 59, that does decrease your risk factor significantly. So let's say, for example, that I'm a person that is interested in my health. I have a cholesterol that's somewhat high. I have LDL that is kind of there, but my HDL is 50. But I began to train for races, do biking, I do kind of some physical training, some lifting, and by exercise, I push my HDL, for example, up to about 59. At that point, my risk has actually significantly decreased, and that is a negative risk factor. So I'm a male, and for example, males have more risk of heart disease. A cholesterol HDL of 59 would then revert that risk back to normal. So this is a very exciting place where people can take control of their own HDL and begin to figure out how to navigate this difficult terrain. In the next session, I would like to talk about how to manage cholesterol using exercise and using medications that are called statins in terms of risk, and how to reduce the risk for heart disease using these medications. Thank you very much, and I look forward to seeing you at the next program for Virginia Medical Updates. Again, this is Dr. Milani.